I love it.
All right, folks. Welcome to, I think we're week 4 already. Week 4, module 152 class meeting. Today we're going to get into a little bit of chapter 5. I'm going to concentrate on the table of neoplasms because that's something I want you guys to have a firm grasp on. We're going to talk a little bit about combination coding and multiple coding, things like that. Let's see, are there any announcements to start with? First of all, those of you who came in late, do not forget to put your name in the chat so I can get your attendance. All right, there's a couple things that I do want to announce. Remember, we talked about my coding workshops that I was doing in the evenings. I was going to start those back up. Here's the problem. My husband works out of town now. So at night, it's just me and Paige. There's no way I can take a couple of hours in the evening and expect her to not be all up in our Kool-Aid. And then it's going to be really hard for us to get anything done. But the instructors lately, we've just been there for each other and really just inspiring each other. So one of our other instructors, y'all have seen her videos, Miss Danielle, she started having an open session so that people could just pop in. It's a Zoom I'm going to set up from 3 to 5 on every Tuesday from here on until we're done with coding. And you guys can pop in at any point in time during that time frame, ask me questions, get coding help. We'll work one-on-one. If there's more than one of us, we'll work in a group, whatever we need to do. I want you guys to know that y'all can come to me. And this is the time you need to come to me, because especially if you're not quite getting the processes of where to start in the manual or where to find certain things. Now is the time to get with me, because we're about to, y'all saw where chapter 5 is going. We're starting table of neoplasms, external causes, and right into chapter 1. So from here on out, through this module and the next one, it's going to be one chapter at a time, coding all day long. Okay. And just figuring out the guidelines on specific body systems and things like that. Where do we find guidelines? Somebody tell me. Beginnings of the chapters, right? And sometimes the beginning of the sections. Take time so I can stay in. Erin, girl, you're gonna finish when you finish, and you're gonna be all right. And we can keep in touch after that. It's gonna be all right.
And yeah, but I just want to stay in school. I'm not ready. I don't think I'm ready.
You are. You are. You are one of my ones that are finishing, that I will confidently say, this girl knows her stuff. And what she doesn't know, she can learn really fast. So don't, y'all, when I tell y'all are doing good, I'm not blowing smoke. Y'all are doing well. I want y'all to be confident in what you're doing. And you need to have that confidence. But again, that comes with time and practice too. Okay, so I understand if some of y'all are like, I'm not there yet. And you might not be quite there yet, but y'all are well on your way. Well on your way. Y'all are doing great. Okay. So don't get discouraged. Don't get discouraged. And again, come to me if you need to come to me. This is what I'm here for. This is my job, is to help y'all succeed and help y'all grasp these concepts that y'all need to know to pass the certification and then to take into your career. Because we want more than a job, right? We want a career. We want somewhere we're going to stay, somewhere that's going to pay us, somewhere that's going to give us the benefits we deserve, right? So, open sessions 3 to 5, starting this coming Tuesday. I'm here for y'all. Your chapter 5 exam is going to be very, very similar to the last few. There are going to be, I'm trying to keep it to a minimum, y'all, but there are going to be true and false questions. I know we all hate those, but they really nail down whether or not you understand the concept. And watch out, because they will trick you up. They will try to trip you up on purpose. Some of these true and false questions, but I am trying to keep them to a minimum, but you're going to see just as much, if not more, coding on every exam from here out as you had on chapter 4. There was a good bit on chapter 4, and some of y'all flew through it, and some of y'all took your time, and that's fine. Take as long as you need. You are not judged on how long you take to take the test. We don't care. That's fine. That's why I don't put a time limit on them, because I want you to be comfortable in your answers and confident in your answers. That's all. Let's see. We are halfway done with this module, or over halfway done now. So if you are behind on that, yeah, I know, Peggy. Yay. Instructors get excited when we get to the end of a module, y'all. We really do. But we are halfway there. So if you are behind on labs, you are behind on exams, you need to retake on an exam, you need to start contacting me now. Y'all saw Miss Marsha popped in a couple of weeks ago, and there's, we are getting cracked down on letting people just not do anything and then opening everything up at the end of the module. It's just not working for us. It's not setting good habits for y'all. So start getting with me now if you need to make up stuff. And here's something else I wanted to say too. And I'm not fussing, I'm just saying, if I reopen something for you, go do it. Don't let it close again and ask me to reopen it a second time, because I'm not. From here on out, I'm not reopening things more than one time. There's no reason I should have to do my job 3 times for y'all to do one thing one time. That's just not fair, and it sets a bad habit. Your boss at work ain't gonna let you do it. It's just not gonna happen. So, like I said, I'm not fussing. I'm just saying that's what it's gonna be going forward. I'm only gonna reopen assignments one time. So let's just keep that in mind. All right, so
I have a question.
what you got,
Ms. Brandy?
What
How
you got?
many chapters are in this module?
In this module?
Mhm.
How many exams are you gonna have?
Does it go up to does it go up to chapter 10 or
7
more
chapters.
7. We cover 7 in 152.
Okay, so it goes up to chapter 7.
Mm-hmm. Yeah. In your textbook.
Yeah, because that's what I was wondering, because I remember when I first started, and it was halfway in the module when I started, it was chapter 8.
You sure about that? Maybe that's
Yeah,
why. Maybe that's why you're
Yeah,
having
me too.
to do the whole module, Julia.
Me
You
too.
might-
because
That's
it
when
started
I
in
think that's when
chapter
we
8
both
because I have
started.
because I have my tablet and I write all my stuff down.
Then
And it
that's why
started in chapter 8.
That's why y'all's end dates are so close to the end of this module. Because y'all started in chapter 8. Chapter 8's in 153. Or y'all started
Yep,
at the
that's
end of
right.
152. And maybe the first chapter y'all saw was probably chapter 8.
Yeah, chapter 8, it was the
So
eyes.
that kind of explains that a little bit as to why you're having to do almost this whole thing. Any other questions or anything else? No? No. Okay. All right. So I want to talk a little bit about one of the first things they talked about in chapter 5 was combination coding and multiple coding. Does anybody have a question about that? Just off top? No? All right. Can anybody tell me what combination coding is? Anybody take a stab at it. Come off of mute. All right. Combination coding.
I have it right here, but I'm reading out the book.
That's okay. Read out the book.
It's when one code fully describes the conditions or manifestations.
That's exactly right. That's exactly right. You have one code that is going to fully describe one particular or one set of conditions or manifestations, whatever it may be. Okay. They did a great example in the book. Y'all hear me talk about the examples in the book all the time, but they had a really great example of this in the book. And it's basically a real simple code, y'all. A real, like the one they used in the book. Peggy, you making me nervous. I don't usually stutter this much.
Doing great. Why am I making you nervous?
I don't know. I don't get nervous in front of Marcia. I'd probably be nervous if Danielle came in here.
Remember, you guys, I've only been here less than 2 months. Why would she be nervous?
Because she's phenomenal. That's why. That's why. She's been here 2 months and made me think about things that I ain't even thought about before. I was like, are you for real? And has provided me with resources that I've been providing to y'all, just passing right on along. She's phenomenal and she knows her stuff. She's
Thank
really
you.
good. But yeah, okay, so combination coding is when you've got just the one single code that's gonna perfectly describe what you got going on there, right? All right, multiple coding. Do we know what multiple coding is? Multiple codes, right? Multiple codes to fully describe the entire condition. And again, great example in the book as to some of the codes you're going to come across. There's certain conditions that automatically include other conditions, right? So they will make a code that encompasses both of these conditions. I'm sorry.
You did it right.
No.
So can I help you?
Yes, please do.
All right.
Please
So you
do.
guys remember, you know how COVID came along 2 years or whatever it came along, right? So when you had COVID and you went to the emergency room, they wasn't really coding COVID. Why? Because one, we didn't know too much about it, right? Two, it probably wasn't a book, but we didn't know what the name was, what it does to the body. What we was doing is we were coding the symptom of our patient. So if you went to the emergency room, you had a fever, backache, that's what we was billing the insurance company, right? So those are multiple codes that we was billing. You could probably have more than 2 codes, 3 codes, 5 codes, it doesn't matter. But now, guess what? COVID has its own code that we could just code COVID. And that will cover your backache, your fever, whatever it is that you have,
Respiratory
unless you have
distress.
complications with COVID. Does that make sense?
Thank you, Peggy.
Welcome. Got you.
Thank you. Exactly. Multiple codes. You may need more than one to fully describe it, or like Peggy was saying, when like the monkeypox thing that we're dealing with right now. Okay. When that first started coming out, we weren't coding monkeypox. We were coding skin rashes, infections, and things like that, and fever and stuff like that. And then we figured out it's monkeypox. And now we have new codes that came out this summer that are not even in our manuals and stuff that we're having to use. And great example, guys, y'all know I work for an urgent care outside of Unitech, and we've done some of the screenings and stuff. And I've had to go back and correct and change some of the coding because it's so new that it's being done wrong. So I've had to research outside of the manuals, go to the AMA websites and the CMS websites and all, the reputable places to go and find your information to figure this out. And sometimes you have to do that when we have, it's a crazy world we live in, y'all. It's a crazy world. So we never know what's gonna come at us tomorrow. But as things advance, so will medical coding. But all right, so we have a better understanding, thanks to Peggy, of combination coding and multiple coding. Yes. Awesome sauce. Okay, I am going to share my screen with you guys. And Okay. All right, so I want to talk a little bit about the table of neoplasms. If you guys would get your ICD-10 manuals out, and I want you to go to, and I hope you have it tabbed, the table of neoplasms, so it's real easy to get to. If you do not have it tabbed, that starts on page 481. Right. And how many of y'all have looked at the table of neoplasms and kind of checked it out, looked how it was set up, all your options across the top, all those fun things that you have to cross-reference to find the right code? I want to go into a little bit deeper discussion, a little bit more clarification on what those options across the top are. You need to know those so you can pick the right code for whatever it is that you're coding, the scenario that you're working with, right? All right, so if y'all are looking at the table, the first column, you have malignant primary, right? All right, this is an uncontrollable abnormal growth of cells within the body. And this is what the malignant primary is going to be, your primary location of cancer. And that's one of the first things too. Whenever you see the word neoplasm, we know that's a key word for cancer. A neoplasm, generally a tumor or something similar. And this is a malignant primary is going to be uncontrollable abnormal growth of cells within the human body. Let's see. Our second column is going to be malignancy secondary. A secondary malignancy is a new cancer that occurs in an individual as a result of previous treatment with radiation or chemotherapy. Secondary cancers may occur months or years after treatment and are a consequence or side effect of the initial cancer treatment. Okay, so something I want y'all to remember when coding primary or secondary cancers also is that your sequencing is going to matter. They may be at the doctor's office that day not treating their primary cancer. They may be treating a secondary site or a secondary something that they've had come up. And in that case, that secondary cancer is going to be your first listed diagnosis. Okay. So you always just want to be aware of that. Keep that in mind when you're coding cancers, that whatever, you know, it's care specific. What are they there for that day? All right. Carcinoma in situ, otherwise known as CIS, is a group of abnormal cells while they are a form of neoplasm. Peggy, you want to help me out with that one?
Yes. Can you hear me? Can you go back to the other one? Because I just want to tell him something.
Sure.
Yeah.
Oh, wait.
So, not that one. Yeah, that one. So think about it. We have two, let's say 2 breasts, 2 arms, 2 legs. We have multiple fingers, 2 ears, 2 eyes, right? But you could go to the office and have cancer on the breast, on the left side. You know, they doing the chemo, just like, you know, Brandy said, they doing the chemo, whatever. And in a couple of months, maybe it comes back into your left, right? But as Brandy said, we was treating, let's say your right? But now we found out that you also have it in your left. Right will be your primary. We'll treat that first. I'm not saying we will not treat the left. We will. But when we code, we would treat the first cancer that we found first. And then because that's the one we've taken care of. And then we'll continue now, probably put you in the radiation oncology or chemotherapy to do both at the same time. Does that make sense? I just wanted to add that because it's kind of like important. All right, go ahead with the other one.
Great ad.
And then this one is the one you want me to go into?
Yeah.
Okay, so remember, cancer, it's cells, right? And these cells can be abnormal or grow faster or, you know, just remain small cells, right? So in here, it's a group of abnormal cells while they are form of neoplasm. So they are cells and they are forming to become some type of cancer. Now, do we know? No. Do we know the area? No. We did a biopsy on a patient and we do not know how fast this cell is growing yet. This is why you will hear a doctor say to you as a billing encoder, we will do a biopsy in 3 months again, and we would know. All right. So that's a perfect example.
Awesome. Thank you so much.
Yep.
That's one that I was not very familiar with.
Mhm.
So thank you for that.
You're welcome.
I'm so glad you came to this one. Okay, so let's talk about benign is your next column. And benign is basically, they might have a tumor or something, but it is not cancerous. It is not harmful to the body, to the person. It's just there, basically. Malignant, cancerous. Benign, not cancerous, safer. Very good. If you have any kind of tumor, you want it benign. That's the one that's the word you want to hear when you have any kind of biopsy or pathology or anything like that. Okay. And let's see. Neoplasm of uncertain behavior. You know what? Who wants to read this for me? I generally don't ask y'all to read a lot, but like I said, it's literally hurting me to talk. So if somebody would be so kind and volunteer to read it.
I will.
Sure.
Okay, neoplasma of a certain behavior are those for which the final behavior cannot be determined at the time of the biopsy. So we don't know how this cancer, if it's spreading, how big it's getting, we just don't know too much when we did the biopsy. On other incisional procedure, because the cell may be undergoing malignant transformation, but a firm distinction between malignant and benign can be made at this time. The pathologist cannot determine what it is because maybe the cell is too small. We could see that it's abnormal, but it's too small for us to determine what it is. All right. The pathologist. I say us like I'm a pathologist.
No, the medical care team.
Yeah.
You know. Awesome. All right. Okay, I couldn't say it better. I couldn't say it better. You know, we know there's something there, but we are uncertain of what it is. This is very similar to when they have another type of disease and it's not specified. We're not sure yet what exactly it is. We can't specify it the way we
Right.
need to. Just
And
yet.
then you guys will hear a lot of probably families, friends that would tell us, you know, I went, got the biopsy. They don't know if I have cancer or not. It's because the cell is not so developed. It's not like an adult cell yet. So that's why.
All right. And our last column is unspecified behavior. Neoplasm of unspecified behavior of an unspecified site.
Mhm.
Now,
Do you want me to tell them?
go for it.
Okay. So again, you know, it's cancer. It comes in your blood that something is going on. We don't know what it is. We don't know if it's benign or malignant. We don't know the behavior of your body. Again, we would have to do additional blood work, CT scan, MRI, biopsy to identify where is the cancer. All right.
Awesome. And we'll say this, y'all, just like with the other codes, your insurance companies are not crazy about unspecified. So if there's a way for you to find out more, if it's just a lack of information, you may have to dig and research and find out. Okay. Because insurance company do not like They do not like the unspecified stuff. They want you to be as specific as you can be. But sometimes you just can't. Sometimes you just don't know. Sometimes we're just not there yet, you know, in the diagnosing process. And that's what this would be for. All right, so I know Zoom, I know. All right, so when you're coding a neoplasm, when you have a scenario, and you see the word cancer, you see the word neoplasm, you automatically know that you are going to be in that table of neoplasms, but you can still start in the alphabetic index. It will tell you to see table of neoplasms if that's where you need to be for that particular thing. So it's like I tell you all the time, there are multiple ways to get to where you need to be to get the correct code. Okay. So don't get disheartened if you start in the wrong place. That's okay. It happens. It happens to me all the time, especially with stuff like this, stuff that I'm not familiar with, you know. I worked for a cancer center as a biller, but I never coded cancer. I never coded tumors and stuff like that. I saw the codes, but I never had to dig in a manual and find out what they were. So while I know what they are and I know what coding is, cancer in the table of neoplasms is not something that's not something I'm an expert at, you know, and that's okay. You know, it, like I say, what you're gonna become really proficient in is going to be determined by who you go to work for and where you go to work as to what specialty they're in. It's just very all dependent. So don't get discouraged. Don't get discouraged. Keep your heads up. Any questions about the table of neoplasms or coding cancer, any of the chapter exercises that y'all have been going through so far? Any issues that y'all have come across?
I'm slow.
It's slow.
I am very slow when it comes to the neoplasms.
That's okay. That's okay.
Yeah, those confuse me. Like, I don't know, they confuse me.
What, anything in particular?
It's like I refer to like the chapter exercise answer key so I can see how I get the answer sometimes because it just confuses me.
Yeah, work it backwards. Yeah, that's a good idea. Is there like anything in particular that I could go into more detail about for you? Or is it just
I think it's just getting
I'm kind of
familiarized.
driving right now, but
all right, well, I'll tell you what, think about it. Get done with chapter 5. Let's think about it over the weekend. Write down anything that you might have a question about. And pop in on Tuesday if you can, Precious. And if you need to do it another time, get with me. Because I definitely, if you're having any kind of problems, you know, we want to clarify as much as we can.
yes, ma'am.
Can I just give them a tip, Brandy?
Sure, absolutely.
Okay, let me give you guys a tip, right? When you go to the supermarket, think about this. When you go to the supermarket and you see the People magazine, right? And you see all these famous people in the magazine, the front of the magazine, usually the front of the magazine will tell you what they're talking about Khloe Kardashian, correct? Yes or no, right?
Yes.
And those are the things that you say, I want to know more about Khloe, so you buy the magazine. Why? Because the front cover told you what the article going to be about Khloe, right? Now, let's back up a little bit. Close your eyes and I'm going to tell you a story and I'm going to guide you through this story. When you go to the emergency room, close your eyes. If you're driving now, don't close your eyes, Aisha. See you driving, don't close your eyes, okay? You're not going to sue me, all right? So you go to the emergency room, right? Close your eyes and you go and you check in and you say, I want to be seen by a doctor, right? And they bring you in the room, in the patient's room, and it's something that is called SOAP, soap. What is SOAP? You will learn this as you go. SOAP, S stands for subject. Peggy, why are you here for? Because I have back pain, right? So the medical assistant or whoever tell me, put this gown on, the doctor will be right with you. Here comes the doctor. This is where the O comes in, objective, all right? The objective is exactly what you saw that magazine that you wanted to buy it. Now the objective is that the doctor will ask you so much question about you. Peggy, what made your back hurt? What made it better? What made it worse? Are you taking over the counter medication? What happened? They ask all these questions. That's the objective. Now, SOA, now the A is assessment, where the doctor will say, Peggy, the reason why your back hurt is because you sprained, let's say L1 or L2. That is the diagnosis. But while this happened in O, the objective could be nurse coming in the room to ask you what happened, another doctor, and another doctor. And you be like telling yourself, I already told the story 4 times, right? Because you have 3 or 4 times you have told the same story. When the doctor go back and do the SOAP note, he needs to write in the medical record what he saw the patient for. SOAP, the P is, here is a medication. This is your prescription. Go to the pharmacy, pick it up, follow up with your primary care doctor, or I want you to make an appointment with neurology. That is the plan, the P, the plan. So when you read a SOAP note, the first paragraph will tell you what we coding. It will tell us what is the patient diagnosis. Diagnosis consists of condition, disease, disorder, infection, accident. 5 things I gave you. So remember that. SOAP, subject objective assessment plan. In the O, that paragraph, just like when we buy a newspaper, the first sentence will tell us what this article is about. Well, the first sentence when you read, because you're going to be billers or a coder, on the first sentence will tell us what we billing because the doctor is giving us the O. Make sense?
Awesome analogy.
All right.
Awesome analogy. Y'all see what I'm talking about here? Y'all see what I'm talking about?
Y'all can invite me anytime to your conference.
Well, I will start in putting you on my calendar. I'll let you know when mine are. You can pop in anytime.
All right. So next time
Usually-
I come, I'm going to bring a SOAP. Okay.
Yeah.
That means a doctor's note. And you're going to read it. And you're going to check it out. And then you're going to tell me what we coding, what we billing. All right. Next time I come here, I'll bring a patient SOAP note.
We're
All right.
here every Thursday at 3:30.
Okay. Next week. But yes, I'll come and show you guys a SOAP note because this is what you're going to get used to. All right. That is one thing. If you're going to learn something from Miss Peggy, learn the SOAP notes. All right. You're going to start reading a lot to code. Don't read so much. Some doctor could go on and on 4 or 5 pages. We're not here for that, doctor. Just tell her what we're here for. He will tell you, they will tell you in the first couple of sentences. All right.
That's right. And remember, y'all, some of y'all that have been here, y'all know in those chapter exercises, they'll give you a page worth of scenario.
Mhm.
And maybe 2 sentences of it are relevant to what we're doing.
Exactly. Mhm.
You know,
Right. Yeah.
that's awesome. That'll be great, Peggy. Thank you
Yeah.
so much.
So I will see you guys next time. I will come next time with a SOAP note ready for you. We could discuss, just bring your book with you. I'm ready. All right.
Fantastic.
I'm going to go because I have to do something with my student.
Not a
Bye,
problem.
everybody.
See you later.
Bye.
Bye.
All right, guys. As y'all can tell, I am hurting. So if y'all don't have anything more for me, we're gonna call it. If y'all do, like I said, if y'all are having any issues getting into the manual, any of the scenarios, making sense of the information, please get with me. Don't struggle through on your own. You don't have to. This is what I'm here for, okay? All right. So everybody be blessed. Thank you again for your time. Chapter 5 exam is on Monday. I will have Monday and Tuesdays stuff, including the exam, open for y'all tomorrow. Probably tomorrow evening, but tomorrow.
No rush.
Thank you, Trish. I appreciate you, girl.
Bye.
All right, ladies. See y'all later.
Bye.
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 Bye.